By 25th November 2021, the Ministry of Health statistics indicated that 48 new COVID-19 cases were confirmed, while the cumulative confirmed cases in the country stand at 127,423. Although there is a decline in the number of COVID-19 cases, the new variant detected in South Africa is worrying, according to experts.
The samples that first had these variants were collected around 9th of November. And the more samples were collected later on in South Africa, Botswana, a traveler in Hong Kong, and now it is spreading. I think the biggest concern with this variant, when it was detected, it has a lot of mutations, meaning changes. When you look at its genetic makeup, it has a lot of changes, especially in the spike region. The spike region is the most important region that the virus uses to transmit, to enter into our cells, and that's where the vaccines work and some of the diagnostic tests. And in addition to the mutations, about 32 in the spike, the whole virus has about 50 mutations. So it has more mutations than any other variant.
According to Dr. Kaleebu, so far at least 100 cases have been confirmed in South Africa and Botswana. Although the Omicron spreads faster, it is not clear whether it is more severe or not.
No proof yet. So for those reasons, because of the mutations it has, which potentially can make it more transmissible, and already there are indications of that, make it difficult vaccines to work, and also severity of disease, it has been named among those variants of concern by WHO.
The professor in immunology has highlighted the difference between the first two variants.
Our comparison is the Wuhan, the first virus. So when you compare the Delta, the Alpha, you compare it with the first one, so they're about 32 more than the original, and about 22 more than even the Delta. Just in the spike region, the numbers may not be the most important because some mutations are of a disadvantage to the virus. It doesn't necessarily correlate that the number of mutations, if you increase the number, then the virus will be more dangerous.
Since testing is one of the measures in fighting the spread of COVID-19, Professor Kaleebu said the new variant can be detected using the PCR test.
The diagnostics can still work, but we are going to continue with our surveillance, but also for the public to continue with the prevention measures, including vaccination. I have a feeling still, as has happened with other variants, the vaccines may also be able to prevent severe disease even with this variant.
It is said that the new variant might not respond well with the current already administered vaccines. So what could be the implications of that?
A lot of the initial work is in the lab. You get samples from people who have been vaccinated. You test in the lab to see whether blood from those individuals can kill or neutralize the virus. Then you get individuals who have been boosted. You compare and see.
What is a booster vaccine?
Now, boosting is after getting your primary vaccination series, and then you are given another, and that is a booster. And that's why we are saying you can mix. You can mix AstraZeneca, maybe with Pfizer and all that.
Kaleebu said the new variant presents similar symptoms like other existing COVID-19 variants. According to Science, Technology and Innovation Minister Dr. Monica Musenero, the new variant will be considered in the vaccine that Uganda is working on.
The science team making vaccines, I've already called them for a meeting. We're going to analyze that sequence. For us, we analyze it very, very detailed. Where did this change take place? From what to what? Then one of our vaccines, we are going to start modifying to make sure that as we go into clinical trials, we have covered this new variant.
Experts are saying that now what needs to be done is for government to ensure they increase surveillance at all border points so that people who are entering through the country are first screened so that they rule out whether they have the new variant or not. And this can be done using the PCR tests. Also, the public has been advised to ensure that you follow the SOPs and go for vaccination, since there is no proof yet that the existing vaccines cannot kill the current variant. Sudhir Yarhanga, NTV, Kampala.